You can start. Let's discuss in our another topic. It will be Vena Cava Superior. What does mean cava?
Hollow.
Yeah, good. Another name is hollow veins, right? Superior hollow vein and inferior hollow vein. Vena Cava Superior. Okay, Vena Cava Superior is located in which part of our body? It's located in mediastinum, right? Mediastinum. Which mediastinum? Yeah, if we repeat the mediastinum, this will be the which structure? If you remember, this will be the sternum, the manubrium body of the sternum, the xiphoid process. Then we have the lower part will be which structure? And this will be vertebral column, and this will thoracic inlet, right? Superior thoracic inlet. And we should divide the mediastinum into two parts, superior part, and this will be inferior. Inferior is divided into anterior, middle, and posterior, right? This Vena Cava Superior is located in superior mediastinum. In which part? That was side view. If we look from the front, this will be our manubrium of the sternum, yeah? Manubrium of the sternum. We have, let's say this is the superior part, this will be the inferior mediastinum. Our Vena Cava Superior is located right side of the superior mediastinum. Is it clear? Then let's talk about Vena Cava Superior. The Vena Cava Superior is a structure which drains into which part of our body? Right atrium. The Vena Cava Superior is formed by which branches?
Azygos.
No.
Internal jugular and subclavian.
Yeah. So like that, right? We have in subclavian vein, internal jugular, which one? Right, internal jugular left, and this was right, and this was left subclavian vein. Is it clear? That was, yeah, this is the brachycephalic, right? This will be the brachycephalic right, brachycephalic left vein. That was the branches of brachycephalic vein. Now let's talk about tributaries. What are the tributaries? It's a draining vessels into the superior vena cava. What are they? The first one? Azygos, right? Azygos. Azygos vein. No. No, we have azygos vein. Yeah, and we have Hemiazygos vein, right? It will drain to the superior vena cava. Let's talk about azygos vein, its branches. The branches of the draining branch of the superior vena cava, it will be the brachycephalic, right? The first one will be brachiocephalic veins. The second one, azygos vein. Let's talk about azygos vein, and we'll be talking separately about the brachiocephalic veins. The tributaries of azygos vein is. Could you tell me what is azygos vein? From where it arises?
From the right.
Yeah, we should write. Yeah, we should hear what this is the coccyx, and this, let's make it, yeah, what's that? Let's make it iliosacral at the level of the sacrum and the coccyx. It's arises from the common iliac vein. It goes up. This is what? This is a right ascending vertebral lumbal vein. At the same time, we have left ascending lumbar vein. First, let's talk about the right one. It will be about azygos. It will be crossing right to the body. Now, right here we have vertebra. It will be crossing right part of the vertebra. Yeah, there is some anastomosis, and it will be going up. Yeah, yeah. It will be going posteriorly in all our cavities, and it has several tributaries. What are the first tributary of the? Yeah, we should keep in mind that the first branch of the azygos will be subcostal vein, right? Yes. As we have, if you remember intercostal arteries, we have 12 intercostal arteries, then we have subcostal artery. The same will be here with the veins. The first tributary will be Vena subcastalis. Okay, the next one will be
Superior part of phrenic.
yeah. We should keep in mind that we cross what? We cross diaphragm. Then it will be superior vena phrenica superior. Yeah. The next one will be
It's a part of pericardium.
yeah. It will be a part of pericardium. We should keep in mind now we have some structures, right? Which structure is this one? Yeah, like schematic. Yeah. The heart, there is inside the heart and around that pericardium. The same time we have some structure near to the heart will be which structure? What's that? Yeah, good. Yeah, that will be, this is the trachea and this will be the bronchus. So before that, let's go back to the next one was phrenic superior vein, and the next yeah, the branch will be getting blood from the pericardium to the azygos vein, right? It will be pericardic vein. And the next branch is yeah, the mediastinal. Yeah, there is mediastinal to all the structures, mediastinum, mediastinal, and
It's go to the posterior part and esophageal.
yeah, there is. Yeah, I forgot to give you information about esophagus also, right? This is will be, let's make it like that, esophagus. Yeah, esophagus, and so it will be giving branch to the bronchus, bronchial, and the next one will be yeah, tracheal, and we have here esophageal, right?
Yeah.
Is there any other branches?
Yes.
What's that?
The right side of the posterior part of the intercostal.
Yeah, and that was like a visceral, and in between them we have what? We should get blood from the intercostal space. It will be intercostal what? Like, let's make it this kind of lines. This will be our ribs, and between them we have posterior intercostal dextra right veins, and we have the another one will be
Right superior part.
yeah, right, yeah, it was the right dextra right one. This will be right, still right superior intercostal vein. Yeah, all this blood will drain into the azygos, this structure, and after that it will drain into what? It will drain into the superior vena cava. And
to frame the superior vena cava, we have hemiazygos.
yeah, that's why I stopped here. That was all the viscerals and branches. Now we're going to talk about hemiazygos, right? This hemiazygos vein. Hemiazygos vein will be going in which part? In our left part of the structures. Yeah, from it was left ascending, which? The lumbar. Yeah, left ascending. This is left ascending lumbar vein. It goes up, right? It forms some anastomosis here, and it passes, and it gives what are the branches?
Posterior intercostal in the left side.
Yeah, the same here, the lines, right? Our ribs, and we have which veins here? Posterior intercostal veins. Then the same time we have superior, that was sinistra, it means left sinistra, and superior intercostal sinistra veins, right? And any other branches. That hemiazygos has another branch also. We have all these organs from the left side, right? From the right side, and we have the same branches from the left side. It will go to the pericardium. It will have some mediastinal. It will give trachea, bronchi to the trachea to esophagus, right? It will repeat all its branches, and after that before draining into the azygos, it forms some connection with which vein? Good. Then we have here, when it turns to the right side, we have here hemiazygos, accessory, right? Hemiazygos accessory will drain into the hemiazygos, and this will get from intercostal which space?
T4 to T8.
Yeah, not T4, like
T8.
interventricular spaces from 4 to 8, right? And any other questions here? That was, I think, explanation of Vena Cava Superior and tributaries of the azygos, hemiazygos, and accessory hemiazygos veins. Okay, let's finish with this one.